Have you seen the headlines that GLP-1 medications like Wegovy and Ozempic, that they lower the incidence of cardiac events, even in people without diabetes? It's one more accolade for what many call the greatest drug breakthrough in decades, if not centuries. But how much of the benefit has to do with the drug, and how much has to do with improving metabolic health? Maybe instead of singing the praises of the drug, we should be doubling down on ways to improve metabolic health. Well, let's dig into the details. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. So I'd argue that we're kind of seeing this study all wrong. Instead of talking about the miracles of GLP-1s, we should be talking about how we need to focus much more on metabolic health. But before we get into the study, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision, so consult your healthcare provider before changing your lifestyle or medications. In addition, please recognize that people may respond differently to lifestyle changes like ketosis, and there isn't one recognized universal response. Okay, so first though, let's review the study. The study enrolled 17,000 patients, so big study, with the history of either heart disease and overweight or obesity, but without diabetes, and then randomized them to either semaglutide or a placebo and followed them for an average of 40 months. So, pretty robust drug study. In the end, those getting the semaglutide had a combined cardiac event rate, which was defined as a heart attack, a stroke, or cardiac death. They had that of 6.5% versus 8% for placebo, and this is at 40 months. Cardiac death alone trended toward benefit in the semaglutide group, but didn't meet clinical significance. So for the combined endpoint, there was a 1.5% absolute risk reduction in 40 months, which means treating 66 people with the medication for 40 months prevents one cardiac event. Now, that's definitely impressive for a population approach, although we have to factor in the cost and the side effects of the medication and what it means for each individual. So the headlines are that even in the absence of diabetes, GLP-1s benefit cardiac health, almost implying that it has a direct cardioprotective benefit unassociated with its benefits seen in type 2 diabetes. But perhaps the question we should be asking, if it's a different reason than the effects on type 2 diabetes, or if it's the exact same reason, simply improving metabolic health. Well, so it turns out that even though the patients didn't have a diagnosis of type 2 diabetes, 66%, so 2/3 of the participants, had prediabetes. And it's a pretty safe assumption that the rest had insulin resistance or metabolic dysfunction, even though the A1C wasn't yet above 5.7, which is the cutoff for prediabetes. We should also note the mean body mass index was 33, right? So the participants were significantly overweight. 90% were on statins, average LDL was 78, with an HDL of 44 and a triglycerides of 134. So the average triglyceride to HDL ratio was 3, which is, pretty recognized as being suboptimal for metabolic health. And I think this is one of the problems we fall into in the medical community, that we define metabolic health as diabetes or not diabetes, like it's a binary concept. But really it's not. We know it's this gradation, and you can have significant insulin resistance far before you have prediabetes or type 2 diabetes. And there are some other important results found in the supplementary results section of the study. And first is that the GLP-1 group lost about 10% of body weight on average. So again, not surprising knowing what we know about these medications. But there's also an important one. Those with an A1C, hemoglobin A1C, of less than 5.7, so less than the prediabetes range, for those individuals, the cardiovascular benefit didn't quite reach statistical significance. Now, it trended that way, but there was a large, what's called confidence interval. So maybe it was the power of the study, or maybe it was just that the effect was less with less profound metabolic dysfunction without prediabetes. Hopefully that makes sense. So in a way, it suggests the worse the metabolic dysfunction, the better the effect. Okay, and then finally, it's no surprise that 10% of the subjects discontinued the medication due to GI side effects that are well known from GLP-1s. So overall, I guess you can say these are relatively impressive results from a drug trial, but it's always important to put that in the context of what's the likelihood of me as an individual, what's the likelihood that I will benefit, and at what risk or cost. So the one twist I want to suggest is that instead of talking about GLP-1s, this study should make us all realize the vital importance of metabolic health. On top of statins and treated LDL and a metabolically unhealthy population, instituting a metabolic therapy improves cardiac outcomes. That's the headline. So perhaps we should discuss other metabolic treatments that help with weight loss while improving blood sugar, insulin levels, triglycerides, and other markers of metabolic health, while reducing inflammation, lowering blood pressure. Oh, and by the way, can also be used as a treatment for multiple disorders, notably psychiatric conditions like bipolar disorder, schizophrenia, major depression, and others. So of course, I'm referring to ketogenic therapy as a cornerstone to metabolic therapy. Not that ketogenic therapy is the only way to improve metabolic health, but it certainly is a powerful way. And we're encouraged by the brain health benefits of ketosis, as recently shown in trials demonstrating efficacy in treating serious mental illnesses. So take the study for what it's worth. It's a call to action to address metabolic health, and a reminder that we shouldn't just define poor metabolic health as the presence of type 2 diabetes and having metabolic health as the absence of type 2 diabetes. We can and should do much better for ourselves and our patients. We can detect metabolic dysfunction and insulin resistance early and help treat it early to prevent future cardiac complications. For some, GLP-1s may play a role in this, and for others, there exist nutritional and lifestyle options that don't require an expensive lifelong medication. And sometimes the two can even be used together. And there was a recent trial published from the team at Bret showing that a ketogenic diet can help people transition off Ozempic and Wegovy without weight gain. All right, well, thank you for watching. I hope you found this helpful. If you did, please like and subscribe and leave a comment, as we would love to hear from you. I'm Dr. Bret Scher, and we'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.